Very importantly, we assess for comorbidity, because one of the problems that I feel medication doesn't help is because we're missing some of the comorbidity issues that are occurring. We do some screening. We heard about the SNAP teaching, so we do a lot of screening. And we do a clinical interview, which takes time. We find out he's had multiple broken bones, repeated to second grade. Older brother was a high school dropout who doesn't work well. No overt family history of mental illness. He smokes cigarettes, a lot of kids do, consumes a lot of highly caffeinated energy drinks, smokes marijuana to calm him down. This is what happens to these kids. The 7-year-old child in your office, in the research office or clinical office, he's now 16, 17. This is what he looks like if he isn't helped and doesn't get any work. And what happens, if you let him continue without some kind of treatment, he becomes an older teenager, he becomes an adult with problems. And there's some very good research, which is at the bottom here, which again, I'd be happy to send to you in terms of the specific citations. The inattention of adolescence persists and becomes difficulty sustaining attention, that's been called paralyzing procrastination, extreme disorganization. The impulsivity persists with losing temper, impatience, quitting or losing jobs, ending relationships, marital relationships, and the hyperactivity may change to what's called inner restlessness. Fidgetiness, the fidgety Philip we talked about, excessive talking, self-selection of an active job. So again, the problem doesn't go away. I think another point to make is that you need to do, if you decide to medicate someone, you need to know who is this person. And so if you do medicate them, it's a matter of stimulants, antidepressants, alpha-2 agonists, and now norepinephrine receptor inhibitors, atomoxetine has been added. So this is what you're dealing with the medication. We have the best evidence, certainly with stimulants, and the best with methylphenidate, but we have some other evidence. Bupropion is very useful for some teenagers and adults. There's a push now for alpha-2 agonists, particularly long-acting, and Strattera has been pushing. Part of the problem, in my view, is that it's hard to get neutral studies. The drug companies have discovered that if you say 2 to 5% of the entire world has ADHD and 75% of them get some benefit with medication, that adds up to a lot of money. And so there's this tremendous push, and they've hired a lot of people to do the studies, and certain groups around the world are very famous for cranking out study after study showing what? These medications all work. And to get head-to-head trials is very difficult. So that becomes part of the confusing aspect. This is what we have now is a tremendous push by the drug companies to use long-acting stimulants, which are very expensive. These are the ones that are out now, approved in the US for teenagers with ADHD. Long-acting amphetamine, Adderall X. We have a number of long-acting methylphenidates. We know methylphenidate works, so we'll hear about that and its use in a minute. Now we have long-acting movements, and we have Strattera. Now there's a new one that's been involved called Intuitive, which is guanfacine extended release. So whatever we say, we don't want medication, it's coming, and more patients will be on these. I think in summary, ADHD, in my view, and others, is an inheritable problem. It persists throughout life, so we need to do something. And medication, psychotherapy of different types, and patient education is probably the way to go. Screen for cardiac dysfunction, screen for other medical psychiatric conditions, monitor regularly your effectiveness, because it will change over time, and make sure your patient is taking the medication. Adherence in the teenager and even the college student can be a major problem. Again, I thank you very much. This is sort of my approach toward this condition in a rapid fashion. There's a lot of references I'll be happy to send to you, and I'll be happy to answer your questions. So medication, yes, but with great caution, and be prepared to follow this patient over a long time. It's not a matter of take your pill, get out of my office. You're now committed. It's almost like marrying this patient. You're committed to a long time. I'm trying to help them out. Thank you.